Terry, how you doing?
Good, come on in.
Right. So you remember me, I'm Carl with ABC Medical, gonna be your technician, and we're gonna be checking out your chair today. Do you want me to take my shoes off?
That's up to you.
All right. And if you don't mind, we're gonna get Rachel, your therapist, online here, and she's gonna just ask you some questions.
Okay.
So I think if we set up here, and I'll kind of try to lean this towards us, that should give us kind of a good view. So log in here. Rachel, can you hear us?
Yep, I can hear you, Carl.
Awesome. I'm thinking about setting you up over here in front of the couch. How's that look?
Oh, so if you could maybe just a little bit closer, that should be good. There we go.
All right.
All right. Hi, Terry. How's it going today?
Wonderful, how are you?
I'm doing pretty well. So just a reminder that, this is the health system's approved telehealth online portal, but there is still a potential breach of confidentiality risk. While minor, we still want to make sure you're okay with that proceeding, talking about medical stuff on telehealth. Are you okay continuing this way?
Yeah.
Okay. So we'll just go over a little bit about what you and I talked about on the phone a few weeks ago, and then we'll take a look at your chair and talk about, replacing it. So when we spoke a few weeks ago, things were going okay. Chair was just, normal wear and tear, worn out, but things were going all right. Anything new about the chair going on? Nothing broke or anything like that in the last few weeks?
No, the chair's just like the wear and tear that we discussed a few weeks ago.
Okay. And just some background about what's going on with you from a medical standpoint. It looks like you haven't been seen at any clinics since we spoke a few weeks ago. Is there any new issues going on with you medically since the last time we talked?
The only issue that's going on new is I'm developing like a redness on the skin where I sit.
Okay. Has anybody taken a look at that?
No.
Okay. So that might be something we need to really think about when we move forward with your chair. We may want to, take a look at your cushion and maybe do some pressure mapping, but we can talk through the rest of the things. I just, would be much more comfortable moving forward and taking a better look at your skin, making sure that one of the physicians takes a look at it and that we're making sure we're getting you the right cushion and the right setup moving forward. I see that you're coming in to see Dr. Hamilton in a few weeks. Do you think if we got you scheduled on the same day, that might work for you to stop at the seating clinic too, and we could finish your evaluation in person?
Yeah, that would work.
Okay. I know we scheduled telehealth because it's difficult for you to come in, but again, I just don't really like the idea of getting you something exactly the same if it's potentially causing you, skin breakdown. So we'll go ahead and continue talking about some things and take a look at how you move around the house and make sure that if we would change anything on your chair, it would still work on your environment. But we're not going to go through the whole process of speccing out your new chair today. Okay?
Okay.
All right. Okay, Terry, just one more question before we get moving around in your house. Are you still using that foam cushion that you got last year?
Yes, same cushion.
Okay, so there are some other options. I'll go ahead and make sure we have them in the right size for you with some molding and gel and air, and we'll take a look at that when you come into the clinic. For now, though, since Carl's there, we can take advantage of that in the camera and make sure that I can see and visualize, and Carl can take some measurements. Just make sure that if we would change any of the dimensions of your chair, that it won't affect how you get around in your house. So if you want to head toward any tight spots like the bathroom or something like that, and Carl, if you don't mind bringing the camera along just so I can get a visual, we can at least get that sort of done well since you're there.
Carl, you?
You good?
Yep.
Yeah.
Let's go.
So just let us know if you need me to move anything. We're heading toward the bathroom for now.
Okay. Yeah, I can see pretty well. That is pretty tight, but it looks like he fits. Yeah, maybe Carl, if you can just get a measurement of that before you come into clinic, so we can make sure if we change anything, he'll fit. All right, Terry. Any other tight spots? Any other?
More here in the bedroom.
Okay. Yeah, Carl, if you can just walk forward so I can see. So pretty tight getting into your daughter's room there. You really can't get all the way in, but we can take a look at that. You've got a lot of camber now, so we may be able to adjust some stuff. You can come on back out.
Right.
And then go ahead and make that right. And is that your bedroom there?
Yep.
Okay, go ahead and just, yeah, tight, but you can make it. All right.
Right.
Okay, you can come on back out. Carl, if you don't mind just taking a few measurements before you head out so that we have them for next week.
Sure.
All right. So Terry, I'll just
Cool. So-
confirm our appointment for next week with Carl and I after you see Dr. Hamilton down in the PM&R clinic, and we'll take a look at your skin and do some pressure mapping and then take the final specifications for the new chair. All right, so we'll give you a call in the next day or so to confirm all that. All right, great. Thanks, Carl.
Okay.
I'll be in touch.
Awesome.